Tamara Chesney was only 33 years old when she was diagnosed with invasive breast cancer.
I did a neoadjuvant treatment, which you do your chemotherapy first, then you do your surgery, and then you follow it up with radiation.
In her war against cancer, Tamara feared childbearing would be a casualty.
I knew that there was some risk to my eggs, but we had to treat the immediate problem first.
2 years after getting the all clear from cancer, she turned her attention to getting pregnant and to Dr. Craig Sweet.
There are a number of patients who had very few options in years past, for example, cancer survivors, where surgery, chemotherapy, radiation may render them sterile.
The first step for any cancer patient is to figure out exactly what the treatment did to their body and get an assessment of their fertility.
He did inform us that because of the type of drugs we were on and for the chemotherapy, that it would have a lot of egg damage if we had any eggs at all.
And that's where the options such as adoption, egg donation, embryo donation really come into play.
She and her husband used fertility drugs. After 4 unsuccessful cycles, they didn't give up, they moved on.
The other options are to use eggs donated from young women, generally ages 18 or 21 to about 31 years of age.
These are the fruits of all their labor.
Kane is the sweetest and the most emotional. Sophie's the princess. I mean, there's no other word for her. She just knows how to work all of us, and he is the crazy man.
Tamara's triplets were conceived using an egg donor. She carried the babies to term in her own womb, proving she could be life-giving after cancer.
I wouldn't accept failure. One way or another, I was going to find a way.
Sorting through her fertility options, Tamara found a way to give birth to her dream. For Lee Memorial Health System, I'm Amy Oshier.